By now you've probably seen the headlines that keto diets are disease-promoting disaster, researchers warn. Or another one, analysis. Keto diets place pregnant women and kidney disease patients at risk of adverse health effects. Or a third, review finds keto diets ups heart risks, cancer risks, dangers to pregnant women, and kidney patients. Now, all of this came from an article published in Frontiers in Nutrition called Ketogenic Diets and Chronic Disease, Weighing the Benefits Against the Risks. Now, this sounds pretty scary. If you're on a ketogenic diet or considering a ketogenic diet, I could see how you would really take pause looking at these headlines. But as with a lot of these headlines, we have to dig a little bit deeper and see what does this quote-unquote study or this review from these quote-unquote researchers actually show? Well, the first step is we have to see who wrote these. So my biggest problem with these headlines, and granted the authors didn't write these headlines, they're sort of clickbait headlines written by the media folks, but the first one, keto diets are disease-promoting disaster, researchers warn. Now that implies that the people doing the research on keto diets are saying these, but no, the people who wrote this review are not doing any research on keto diets at all. Instead, they are members of the Physicians Committee for Responsible Medicine, which is a pretty catchy name, but all you have to do is go to their website to see that the bias is pretty strong. Now, interestingly, we just did a video on bias, so the timing is very good. So with that introduction, let's get into this a little bit deeper. I'm Dr. Brett Scher, the medical director at dietdoctor.com, and one of our big missions is to sort of clear the air and to be very clear about when something is truly evidence-based, when it's just being presented in a one-sided fashion, when the evidence is confusing and not consistent in terms of the type of evidence that people are using. So that's how I want to look through this review article, because I think it does have some pretty serious problems that need to be brought to light. Now, as I mentioned, the authors are all from the Physician Committee for Responsible Medicine, and straight from their website, it says they're dedicated to saving and improving human and animal lives through plant-based diets. Right away, you got to know that you need to take all of this information they're providing with some skepticism, because they clearly have an agenda. Just like, a lot of the Netflix documentaries, but just like you would want to know if there was something similar written by the meat industry, right? Or written by someone with a keto online group, right? You would want to know who it's coming from. So right away, we know it's coming from a very biased group, but that doesn't mean we can discount it right off the bat. It just means we have to have a higher level of skepticism when analyzing it. So let's go through this. Now, first of all, any diet that is low enough in carbohydrates can cause people to go into ketosis and produce ketones. So, and there are a number of different kinds. And interestingly, in the beginning of this review, they acknowledge that there are different times, whether it's what they call the 4-to-1. Now, a lot of people haven't heard about that, so let's explain that. The beginning of ketogenic diets were used for childhood epilepsy, and they were very high fat, low protein, low carbs. So that's the ratio of fat to protein plus carbs was 4-to-1. Now that's a very specific type of ketogenic diet that really is not used hardly at all anymore. Even for childhood epilepsy, there's now evidence that a modified Atkins diet is effective. But the modern day ketogenic diet, and the ones that are in trials for reversing type 2 diabetes or treating type 2 diabetes and for weight loss, do not use that 4-to-1 ketogenic diet. So right away, I've got a little bit of a problem, because you'll see throughout their review, they're referring to studies specifically in that 4-to-1 type diet, when in reality, if for the average person starting a ketogenic diet, that has no basis in reality. So that's one problem, that they're sort of conflating the evidence. And the other thing is a number of the trials simply lower carbohydrates and let you eat as much fat or protein as you want without prescribing a specific macronutrient content. And that's really important, because that's what really the modern day ketogenic diet is. You lower your carbs, and you fill in the rest with protein and fat as fits you, as fits your lifestyle and your taste and what you're trying to achieve. So it's not a specific macronutrient composition, which this review sort of assumes. But the next section they go into is what they call nutrient metabolism. So here's a quote: "To induce the liver to make ketones in the fed state, carbohydrate intake must be minimized and fat intake increased." Now, again, this is sort of a myth and a common belief that's not necessarily true. And Adele Hite just published an article on our site about the common myths about fat in a keto diet. And actually, when you look at the science, when you look at the studies, the actual studies in ketogenic diets, what they show is that the fat percentage may go up, But since calories naturally go down, the absolute amount of fat doesn't go up at all, or it goes up a tiny bit. So when people are transitioning to a keto diet, usually their fat intake does not increase. So that's kind of goes against, that science goes against this assumption they're making in this article. Sure, some diets do dramatically increase fat, but that's not actually what's commonly represented in the literature or in the most common keto diets. But here's another problem. The next statement really gets me. The body shunts as much protein as possible to gluconeogenesis, right? So as much protein as possible to new gluconeogenesis, while the minimum necessary amount is used for tissue repair. Boy, was I interested to see where this came from, but there was no reference. Now that's disappointing. That's a really strong statement to have no reference for, because that just, I don't think that's true at all, and I would love to see where that came from. That's just their assumption that they're passing off as a fact. And that's pretty problematic too for something like this. Anyway, we're definitely seeing a lot of weaknesses already. So next they go into dietary quality, and here again we've got another misconception and assumption and a big weakness of this review. They assume that you're basically eliminating vegetables, that we're missing out on all the nutrients in vegetables, but that's simply not true at all. Above ground vegetables are basically an unlimited food on most keto diets. Again, if you're talking about a 4-to-1 ketogenic diet, fine, but again, that's not what we're talking about for ketogenic diets for weight loss and for type 2 diabetes and for metabolic syndrome and NAFLD and PCOS. We're talking about a diet that has an abundance of above ground vegetables. So it's not true at all that keto diets are low in vegetables. And when you talk to most people who start a ketogenic diet, a lot of them say, wow, I've never eaten this many vegetables in my life. So misconception. So here's another quote about that. Many of these diets lack vitamins, minerals, fiber, and phytochemicals found in fruit, vegetables, and whole grains. Again, simply not true. Then they, on the same assumption, say that ketogenic diets are low in fiber. Well, sure, some ketogenic diets can be low in fiber, but most are not. A ketogenic diet is not by definition a low fiber diet. Now, interestingly, all the evidence showing benefits of fiber are done in high carbohydrate diets. We actually don't know if fiber is beneficial in a low carbohydrate diet or not. But that's beside the point, because the assumption is ketogenic diets are low in fiber, which they are not and certainly don't have to be. And then the next statement, also really concerning. So low carbohydrate diets are also often low in thiamine, folate, vitamin A, vitamin E, vitamin B6, calcium, magnesium, iron, and potassium. Let's think about this. Thiamine is in meat and milk. Folate, asparagus and avocado. B6, poultry, pork, and nuts. Calcium, dairy, all over the place. Iron, meat, hello. Potassium, avocados, like these are the staples of a low-carb or keto diet. How can a keto diet be deficient in these micronutrients and vitamins? That just doesn't make sense. That's very poor research and poor writing from my standpoint. Okay, then they go into specific medical conditions. So they talk about seizures, and they acknowledge how it's beneficial for treating drug refractory epilepsy. But the other role it plays is actually reducing the dosage of drugs. So, we have to be honest, seizure drugs are terrible. They have serious side effects, serious mental side effects. So being able to lower those drugs is really important, which they can also do. But they also say long-term adherence is challenging. Well, okay, any diet is challenging in kids, especially when you're talking about a 4-to-1 type diet. So that's very different than a modified Atkins diet and in adults. So again, two different issues there that they sort of just all combine into one. But the meat of this is sort of like weight loss and diabetes, I think. So a little concerning right away when they start talking about weight loss. This is where they start talking about diets that define low carb as less than 40% of calories or less than 30% of calories from carbohydrates. That's not a low carb diet. That doesn't fit their own definition that they acknowledged in the beginning of the study. So why are they including these trials? These trials have no place in a review of ketogenic diets. So when you start weaving these other studies in that with different definitions, that just confuses the matter. If you're going to write a review about ketogenic diets, please stick to the data on ketogenic diets. And we're going to see that this comes through time and time again. And then next they go into talk about ketogenic diets and how they reduce hunger. So they acknowledge that they reduce hunger. So that's great, because that is true. There are plenty of studies showing that ketogenic diets reduce hunger. But then they try to introduce evidence to say, well, maybe that's not the case. And they're citing a 2-week study, a 2-week metabolic ward study. That's really concerning. That just shows such strong bias that you would do that and not acknowledge that the time frame is really just insufficient to really make any conclusions from. Because what happens in the first 2 weeks on a keto diet as you're going through an adaptation period and maybe having the keto flu has nothing to do with what happens for the next weeks and months or years that you're on a keto diet. And that's where those trials, the longer term trials, show appetite suppression. So again, they're introducing data that doesn't belong there. And this is really interesting because then they talk about some of the data from Dr. Ludwig that says energy expenditure has also been shown to increase on a ketogenic diet, at least in short-term studies. Now, maybe I'm being nitpicky here, but they throw in at least in short-term studies for that phrase. But they didn't throw it in acknowledging the short-term studies for the metabolic ward studies and the problems with only using short-term studies. So I don't know, maybe I'm being nitpicky, but I can see the language. You can see the bias that's clearly coming through here. Now, next, they cite a number of meta-analyses, which they're correct to cite that in short-term studies, 6 months or less, weight loss is better on a ketogenic diet than most diets it compares. And then over time, that weight loss sorts to equal out. But here's a little bit of the concern. And we've written about this before, and I've done videos about this before. The Diet Fit study is a perfect example. It starts off as a ketogenic low-carb diet versus higher carb diet, but then over time, those curves come together because they liberalize the carbohydrate intake. But yet somehow these are still included in the meta-analysis of ketogenic diets, which again, they shouldn't be, because by the end of the trial in that one, they were eating 130 grams of carbs in the ketogenic group. There's no way that's a ketogenic diet. So that's a problem when you just cite this evidence without talking about the specifics of it. And that's why I've made some videos and some posts before specifically addressing this. So I recommend you go back to look at those for more of the details. But as you liberalize carbs in this diet, it's no longer a ketogenic diet. So you can't make conclusions based on those studies. And so that's problematic. And then again, they throw in more studies about defining low carb as less than 35% of calories. So again, that shouldn't be there. That absolutely should not be there if you're talking about ketogenic diets. And then the next part was kind of interesting too. They talk about a study that showed in the first 2 weeks in a ketogenic diet, you lost more fat-free mass. Now, an assumption can be fat-free mass is muscle, but actually it's water. On a ketogenic diet, we know you lose water because you're spending your glycogen. Glycogen's connected to water, so you're losing a lot of water weight. Well, that's really important to acknowledge that you're losing water weight. But then at 4 weeks, the amount of fat-free mass being lost was the same as the control diet. And again, do we really care what's happening in 2 and 4 weeks? Or are we more interested in what's happening in 6 months, a year? These authors are clinicians, so I assume they're more concerned with long-term effects, but yet they're quoting sort of these short-term studies to kind of, I guess, prove their point and fit their narrative that ketogenic diets are dangerous. But that just doesn't fit. It doesn't make sense because it's not true once you get past that 2-week period. So again, I find that a little concerning. Next, they go into type 1 diabetes. So first and foremost, ketogenic diets on type 1 diabetes can be really beneficial, but are really challenging to do. I acknowledge that. So if you have type 1 diabetes and you're thinking of doing a ketogenic diet, do not do it on your own. Definitely do it with a healthcare professional. And go back and listen to my podcast with Dr. Ian Lake and look at the research from Type 1 Grit. That shows, ketogenic diets are absolutely safe and effective, but need to be done very carefully with guidance. They cite some evidence about risk of ketones. Well, sure, if you're not doing things carefully and your ketones rise too high, that can be a risk. But if the ketones themselves are not the problem, it's the non-compliance that's the problem. So their type 1 diabetes section is also pretty biased from that standpoint, but definitely work with your physician. And they talk about dyslipidemia, which really is not a concern for the majority of the people, and we're going to talk about that a little bit more in the cardiovascular risk section. But next, the big part is type 2 diabetes, right? Ketogenic diets are really being promoted for treatment of type 2 diabetes, where there's good evidence that they are very effective. So here's a quote. Ketogenic diets depress appetite, promote weight loss, reduce blood glucose values, and decrease hemoglobin A1C in the short term. Some studies have reported improved insulin sensitivity. The effect appears to be dependent on fat mass loss or loss of fat mass. And they've repeated that many times, that the effects appear to be dependent on weight loss. And there are studies that suggest that to be true, and there are studies that show benefit without any significant weight loss. In fact, we recently covered a 3-case study, but even before that, the Journal of Clinical Investigation Medicine, there was a study showing benefit without any significant difference in weight loss. So there are studies showing that there's something besides just weight loss going on. So, they kind of cherry pick the data to fit that narrative. And, that data exists, sure. But we also have to acknowledge the other data that exists suggesting that there's something beyond just weight loss. Then they talk about sort of the inducing insulin resistance. And this is really interesting. If you're on a ketogenic diet and you challenge somebody with a high carb meal, you show signs of insulin resistance. And that is absolutely true. But what we also know is that if you stick with higher carb for a couple of days, that goes away, right? And that's an expected physiological response. So I think that's a misrepresentation of the data to say this is a problem with the ketogenic diet, that it induces insulin resistance. Well, Not really. I mean, it's a temporary physiological effect, which you absolutely expect when you're restricting carbohydrates and your insulin levels go down real low. And that's not really sort of a clinical issue if you're staying on a ketogenic diet and that's what you're trying to do to treat your type 2 diabetes. So that's sort of a non-issue that just sort of confuses things, I think. Next, I talk about the meta-analysis that show that the effects wane over time. Well, of course, as you're increasing carbs in the diet in these studies, as I've shown, or as compliance goes down, the effect is going to wane. That makes sense. But interestingly, they don't talk about the Virta Health studies, the Sarah Hallberg studies that show up to 3 years, good compliance and good treatment of type 2 diabetes. They don't really acknowledge that when they talk about the meta-analyses with the studies that do increase carbs and have poor compliance. So again, sort of a one-sided presentation. Although they do acknowledge that studies like Dr. Hallberg's studies can remove medications, which is very important from a cost and side effect standpoint. But then here's one of the biggest problems. Then they go into prevention of type 2 diabetes. And again, this is where they just go off the reservation in terms of actually talking about ketogenic studies. Well, first, they completely ignore the study that showed a 50% remission of prediabetes. So that shows with a ketogenic diet. So that shows pretty good prevention there, but they don't mention that. Instead, they go back on observational nutritional studies, which are very poor quality, using food frequency questionnaires, just wrought with healthy user bias, with very small hazard ratios. And they talk about how those studies show that meat, poultry, fish, eggs, and cheese are associated with type 2 diabetes. Well, again, this has nothing to do with low carb or keto in any way. This is in hypercaloric, high carb, high fat type diets with all those caveats of nutritional epidemiology. So if you're talking about a review of ketogenic diets, this type of research has no place here at all. And introducing it just confuses the readers to make them think, well, okay, this must be, since this is about ketogenic diets, this must be about ketogenic diets. So that's concerning that these foods are linked to diabetes, but that's not the case at all. Certainly in the context of a healthy low carb diet, there's absolutely no evidence that those foods are linked to type 2 diabetes, and actually they can help reduce blood sugar and improve type 2 diabetes, and the studies are pretty clear about that. So yeah, that's pretty concerning that they would include that data in there. Then they talk about NAFLD, and this was interesting. They talk about the breakdown of where triglycerides come from in most people, in healthy people, and they're clear to say healthy people. But healthy people aren't getting NAFLD, so I'm not sure how that relates at all. Again, that's just sort of confusing that they would include that without putting in the caveat that healthy people don't get NAFLD. So maybe it's it is completely different where those triglycerides come from in people who have metabolic dysfunction and insulin resistance and are obese and have NAFLD. So that again, that's just misleading. So, and here's a quote: ketogenic diets typically increase intake of saturated fat, cholesterol, and animal protein, all of which are associated with insulin resistance, oxidative stress, and an exacerbated flow of free fatty acids to hepatocytes. Again, in what context? Not in a low carb or keto context. There's absolutely no evidence that saturated fat, cholesterol, animal protein in a low carb or keto context are associated with these negative effects that they're talking about. But in high carb, high fat, hypercaloric, and nutritional epidemiology studies, sure, there is that association, but it doesn't apply to their review of ketogenic diet. So we have a whole guide on NAFLD, on non-alcoholic fatty liver disease, which I would direct you to look at for the other side of this, with sort of a more balanced evidence-based approach. Oh, they also say in epidemiological studies, diets high in saturated fat, trans fat, simple sugars, and animal protein, and low in dietary fiber and omega-3 are thought to contribute to NAFLD. Again, within the context of low carb or keto diets, that just has no point of being there. So now we get into cancer, and they're absolutely right to say that there aren't many studies of a ketogenic diet in cancer. Right now, it's very investigational. I have a podcast with Dr. Angela Poff, which is one of my favorites because it really shows how a scientist is supposed to speak about the evidence. And she's very clear about, the quality of the evidence, the stage of the evidence. So we don't have a lot of good trials showing ketogenic diets treat cancer. And if you're thinking about doing it, definitely work with your cancer doctor. There's a lot of case reports, a lot of hypothetical reasons why it would work, but work with your healthcare practitioner. But the problem that I'm most concerned is when they talk about prevention, because once again, they go right back to the nutritional epidemiology studies and that have nothing to do with low carb or keto diets and are very poor quality evidence. Again, that is no point. That is no place in a review of keto diets. And I'm sorry that I keep repeating this, but I feel pretty strongly about this because it's so confusing to put that in there when it has nothing to do with low carb or keto. We have a whole guide on food and cancer and the relationship. I suggest you look at that. We have a whole guide on red meat with a section on cancer in there. I suggest you look at that. It gives a broader perspective of what the evidence actually shows, all levels of evidence, and the magnitude of evidence, which I think is really important, and how it doesn't really relate to a low-carb or keto diet, which is really important. Then Alzheimer's disease. So they do acknowledge the benefits of keto diets on Alzheimer's disease. And here's interesting, but then they question whether the benefits would maintain upon discontinuation of a diet. Well, would they question whether benefits would be maintained from a drug once you stop the drug? Or would they question whether benefits of a vegan diet would be maintained once you stop the vegan diet? So why are you introducing the concept, all ketogenic diets work, but what happens when you stop them? Well, maybe if they're working, you don't stop them and you just keep using them and then they keep working. Just a thought. Anyway, so that's pretty confusing. And then for prevention, again, they go back to the same nutritional epidemiology. I don't want to rehash it again, but again, it has no place here and doesn't apply to low carb or keto diets and is such weak quality evidence from an individual basis, it doesn't really matter. All right, now we get into cardiovascular disease. So here's interesting. They start right away with the concern. The effect of low-carb diets on plasma lipid concentrations is a major concern. Major concern. So lowering triglycerides, raising HDL, reducing small LDL with overall no net effect on ApoB is a major concern. Because that's what this science shows. So they cite two studies. 30% of subjects had an LDL increase around 10%, but no mention of what happens to their triglycerides, the HDL, the size of the LDL, their ApoB, or their cardiovascular risk. So again, it's just painting one side of the picture without including the whole picture. Now, interestingly, they cite Sarah Hallberg's study showing that LDL goes up 10%. I love that they cited the study, and I was waiting for the rest of it, right? Because from that exact same study, but they left out the rest of it. Well, what's the rest of it? From that exact same study, LDL-C went up by 10%, but ApoB, the better and more important marker, didn't change at all. And when you calculate their 10-year cardiovascular risk, it went down by 12% in the exact same study, but they only presented the part that LDL went up by 10%. So again, that's such clear bias to leave out in the exact same study all those other factors that actually showed cardiovascular benefit. They have a section addressing small versus large LDL, and to be fair, that is sort of unsettled. They cite one study that showed there's still a small increased risk from increasing even large LDL, although not as much as a small LDL, and the risk was low. But definitely significant. But they don't talk about the studies that show there was no difference between the difference in small and large LDL. So that's a little concerning. And they are not low-carb studies. They don't control for metabolic health. So again, does it apply to a review on ketogenic diets? Well, maybe not. Then we get into HDL. Again, they can cite genetic and drug intervention trials to show that higher LDL is not necessarily better, but that's not what we're talking about here. We're talking about nutrition and lifestyle, which is a completely different story. It's clear from the evidence that you don't want to have low HDL. So how can you not have low HDL? Well, low carb diets are kind of the best way to not have low HDL. But that doesn't fit for, that's not a genetic study. That's not a drug intervention study. That's a lifestyle study. So again, they're only presenting the one side of the data and not the other. Okay. And then again, there are studies out there that show when you compare what's called the lipid triad, which is low HDL, high triglycerides, and high LDL, to an isolated elevated LDL, they're very different in terms of their prognostic implications. There are a number of studies like that, which they don't cite. But I would agree that that's unsettled, and I could see why they would leave that out. All right, now let's go into kidney health. So stones could be an issue, sure, and they acknowledge that, and that could be true. But interestingly, they talk about animal foods. They don't talk about the oxalate food. So, nuts and spinach can dramatically go up on a keto diet. And if you've had calcium oxalate stones, that can increase your risk of calcium oxalate stones. Animal foods, if you've had uric acid stones, animal foods can increase your risk of uric acid stones, but those are very rare. Those are one of the least common causes of kidney stones. And the risk is really only there if you've already had kidney stones in the past. But they fall back on this nutritional epidemiology that has nothing to do with low-carb data, poor quality data suggesting animal foods increase the risk, which is not necessarily the case across the board. So it's very limited presentation of the data. And then they talk about chronic kidney disease. Now, actually, Dr. David Unwin just published how in his patient population on a ketogenic diet, kidney function got better. And so we're going to review that as well. And we have a whole guide on kidney disease that goes through all the evidence. But, the majority of the science is very clear that whether it's a high protein diet, which not all ketogenic diets are, or low carb or ketogenic diets, they don't hurt kidney function if you have normal or mildly impaired kidney function. Now, interesting, they quote a meta-analysis of randomized controlled trials. And I love this because this is from the trial itself, right? This is from the conclusions of the trial. In general, the evidence is of low or very low quality with suboptimal quality of the contributing studies and clinical heterogeneity, including considerable variation in trial duration, baseline kidney function, cause of chronic kidney disease, and the definitions of a low-protein diet. So it was specifically what they quoted was something looking at a low-protein diet. And the authors themselves acknowledge that the evidence is low or very low quality. I don't know that this has any role in trying to bolster your case when even the authors admit it's so low. And then, of course, they go back to nutritional epidemiology studies as well, which don't have any role. Now, pregnancy is the next one, which is kind of interesting. So the problem with pregnancy is we're never going to have randomized controlled trials. That just is not going to happen in pregnant women. So, and if you are pregnant, again, don't do anything on your own. Talk to your doctor about it if you're thinking about having a ketogenic diet. Just know the evidence they present is pretty weak evidence, but if you're concerned about it, talk to your doctor about it. We know ketogenic diets are helpful for weight loss, for people who are obese, and for gestational diabetes. So there certainly could be a role in pregnancy there, but again, work with your physician on that. All right, now a little section on adverse effects. So they talk about the ketogenic flu as if it's like a big problem. Well, we have a whole section, again, a whole guide on ketogenic flus. It's well known for the first couple weeks. You may feel symptoms of ketogenic flu, which are pretty easily overcome with hydration and electrolyte and salt replacement. And it's not a big deal because it's temporary and pretty much everybody gets over it pretty quickly. So I'm not sure that has a role there for adverse effects. Now, they say the long-term tolerability is not sustainable for many individuals. Well, that's basically true of any randomized dietary intervention. Would they say the same about vegan diets? Because that's true. Would they say the same about low-calorie diets? That's true. But again, they should maybe cite Sarah Hallberg and VertaHealth study showing 3-year very good tolerability, very good compliance. I mean, that goes against that. Again, very one-sided approach there. They talk about bone health. They should cite one short-term study with indeterminate outcome measures, just surrogate markers rather than actual bone health. We have a whole evidence-based guide on bone health, which goes through a much more detailed analysis, which shows low-carb and ketogenic diets are not a concern at all for bone health. And then again, they cite concerns about all-cause mortality with low-carb diets, not clarifying that, again, this is one of those studies using 40% as a definition of low carb, which has no place in a ketogenic diet review, and it's poor quality nutritional epidemiology studies. So that's pretty concerning. So in conclusion, look, it's clearly a biased presentation. I mean, there's no question about that. They're consistently mixing poor quality nutritional epidemiology studies and which have nothing to do with low carb or keto. And then they're mixing in evidence from the 4-to-1 ketogenic diet when that is a very specific type of a ketogenic diet and not the most commonly used ketogenic diet. If you're going to do a evidence-based review on a ketogenic diet, you got to stick to evidence that's on the ketogenic diet. You can't pull data from non-ketogenic diets and just present it as if it applies, because it doesn't. So in the end, I hope this was helpful so you can see through the pretty clear bias and the one-sided presentation and misrepresentation of a lot of the data. I've mentioned a number of different guides we have at dietdoctor.com, which will give a much more thorough and detailed evidence-based approach and help you see the other side. So I don't know, it's a little disappointing, especially the headlines. I mean, the headlines that come out of this are really scary, but the science doesn't back up the headlines. What's included in this review doesn't support the headlines and is not that scary. And look, we're trying to help people. And from my standpoint, we want to find a dietary pattern that will work for people, to help them lose weight in a healthy way and help them feel good and enjoy their lives. And there's no question that different versions of low-carb diets can serve that role for many people, including a ketogenic diet. And I would say a vegan diet can serve that role for some people as well, as long as it's done appropriately. But when you start out with such a strong bias like the Physicians Committee on Responsible Medicine has, with their mission specifically being plant-based diet and animal welfare, then they're not going to want to try and find something that works for patients, I guess, if it involves animal foods, if it involves a ketogenic diet. And that's disappointing because we should be first and foremost concentrated on the patients. At least that's my take on it. All right, that was a long review. Hopefully it was helpful. If it was, please click thumbs up and subscribe down below. And again, check out all our resources at dietdoctor.com, which will help explain this in more detail. We'll see you next time. Thanks, everybody.